6:39 coming up towards 6:40 in Trinidad and Tobago. COVID-19 cases and deaths remain a concern locally. Sadly, 8 more succumbed to the virus and 218 new cases were reported yesterday afternoon. The start of the flu season is also a concern for medical professionals. However, the CMO, the Chief Medical Officer, Dr. Roshan Parasram, says the COVID-19 protocols have worked to keep cases at bay. Well, we're joined now by a couple of members of the Trinidad and Tobago Medical Association for their perspective on this and the new mutation of the Delta variant. Dr. Vishy Bihari is the president of the association, and we also have with us a member of the council, Professor Hariharan Sitharaman, based at the University of the West Indies Department of Anesthesia and at the Intensive Care Unit, and he's responsible for clinical and critical care as well. Good morning to both gentlemen. Thanks very much for taking the time to join us. And I suppose while we might like to spend all the time talking cricket and World T20 and so many different things, we have the more important and pressing issue of COVID-19 to talk about. And if I can start with you, Dr. Bihari, based on all of the evidence, all of the data that, and indeed all of your own experiences on the front line, what is your sense of us managing this situation? Dr. Bihari, good morning to you.
Good morning, Mr. Mohammed, and thank you for having us once again. It definitely is one that can be challenging at times to be able to manage both COVID-19, the rise in cases, the Delta variant, and to put on top of that the flu season. We do agree that the protocols, the public health protocols practiced during COVID is one way of slowing the spread of even the flu virus. We all know and we have seen that infectious diseases spread very easily, and even respiratory illnesses like the flu virus and like COVID spread very easily from close person-to-person contact and so on. So we certainly take that same view and position that if we maintain and continue our public health protocols, we would be able to slow the spread of even the flu virus. We have even seen, and as we would have mentioned numerous times on this show, that when COVID hit and we instituted public health protocols, wearing masks and hand sanitizing and social distancing, we have seen some decrease in infectious diseases and respiratory infectious diseases and the spread of those diseases. So we think that if we continue those protocols, we'll be able to manage it. Of course, in the context of COVID and the continued death rate and the Delta variant and continued cases, we still hold to the view that really and truly slowing the spread of the virus requires a multi-pronged approach. It requires us as healthcare professionals to continue to educate and advise our patients on the public health protocols, on controlling, most importantly, controlling their chronic medical conditions, so as to not create a severely immunocompromised state in their bodies. And also, one of the prongs to approaching this is vaccination. And we will continue to encourage and advise patients on vaccinations.
Let me bring in the professor into the discussion as well. Professor Sitharaman, thanks very much for making yourself available to give us your perspective. How do you see things going? Because we see today the World Health Organization announcing that because of this vaccine inequity, with the rich countries controlling the vaccines and the poorer countries having very little access in many cases. Fortunately for us in Trinidad and Tobago, we've eventually had a surplus of vaccines. They're saying that the virus is going to be extended for probably a year longer than would have been initially intended. But in a local context, Professor, how do you see the situation? Good morning to you as well.
Good morning, and thanks for having me. I must say that our public health regulations so far have worked reasonably well. We haven't seen major spurts. I know that you mentioned about the 8 deaths last night, and then the statistics, I have to qualify the statistics. Now, what can happen is that even in fully vaccinated persons, there can be breakthrough infections, even with the original virus. Now we are facing all the mutated virus, and so the transmission will be much more than the original virus. So breakthrough infections are not unexpected, and anybody to say that vaccine will afford 100% immunity is completely a misconception and myth. So that is why until we develop a herd immunity, which is at this point of time, because of all the variants, 80% of the people have to be vaccinated. And that is why, this whole tussle between whether to vaccinate children or go and give a booster dose or share the vaccines with the countries where they haven't even started 1% or 2% of their population vaccinated. That is the biggest philosophical questions we are facing. But currently, the statistics which I wanted to qualify is that now, in the context of breakthrough infections, now I can be fully vaccinated, all right? And then I go into a hospital with a chest pain. Now, I would have contacted somebody who had a COVID. So my airways may be lodging the virus, okay, even though I am fully vaccinated because of the breakthrough infection. So when I go into a hospital with a chest pain, they are going to do a COVID test. So the COVID test is going to come positive. So I will be transferred to a parallel healthcare system. But my original problem is a chest pain and a heart attack, probably. I go there and then I had the worsening of the heart condition, and then I die on a ventilator. But I will go into the statistics of a COVID death. But we have to now again tease out that how many of these deaths were indeed because of the pathology of COVID. That is what we have to see. So anybody who dies in the parallel healthcare system with a COVID positive need not always be, severely ill because of COVID per se. The pathology of the COVID storm and the cytokine storm, which is causing the ventilator and so on and so forth. So I can go for, when that big chunk of population is being vaccinated, there will be the prevalence of naturally occurring diseases. People will develop heart attack, people will develop stroke, people will develop Guillain-Barré syndrome and so on and so forth. I mean, it was there even before the vaccine. So throughout the world, we have crossed 4.5 billion, vaccine. And because of the breakthrough infection, they all go into the parallel healthcare system. But we need to still tease out the statistics as to how many of these deaths were indeed due to the COVID pathology. Only then we will be able to say that, okay, how much of the vaccination has provided or afforded. But there are plenty studies. We haven't done this here in Trinidad, but throughout the world, there are lots of studies which which specifically tested severity and mortality due to COVID and also transmission. And the transmission, the vaccination with the Delta virus and the new variants, actually the transmission is not fully protected. The amount of transmission, the protection from transmission is coming down. I agree with that. But still, vaccination is very effective. And I am very, very sad to see that it has become like an institutionalized religion to say that, okay, I will be vaccinated, I won't be vaccinated. That type of a thing should not be there in this day and age. We have to follow science.
Let's pause for a moment, because we know that is an ongoing discussion. From the moment we started interviewing you gentlemen and others in the profession in relation to this attitude towards the COVID-19 vaccine, we've been going on and on with this particular situation. But let's pause for a moment and then we'll come back trying to tease out some more information from our two guests from the Medical Association. 6:48 in Trinidad and Tobago. And as we go to the break, here's a sunrise captured in Maracas at the Maracas Lookout by Lynn, and indeed we've had quite a few images from that very famous point in the area of the Maracas Lookout with the sunrise, and a very nice image as well as we go to the break.
A massive crowd gather from all over. I know, but better days are coming, change your ways.
Coming up towards 6:53 in Trinidad and Tobago. So we still have a few minutes with our two guests. Dr. Vishy Bihari, President of the Medical Association, and also a member of the association, is Professor Hari Haran Sitharaman, based at the University of the West Indies. Gentlemen, in the time that we have available, Dr. Bihari, what's the most important thing? What would you like to leave with us this morning as your most important messages to us?
I think there are three important things I would like to point out and reiterate. First of all, I would like our population to understand and to recognize that any respiratory illness, the symptoms and the signs that you may present with can also be COVID. And from time to time, we must consider that not because we have symptoms of a respiratory illness, it is not COVID and it is a regular flu or some other issue. When a doctor says, well, I should rule out COVID before considering that it might be some other medical illness or respiratory illness, that is something you should consider as well, simply because the one that is more life-threatening, the one that can cause you to die or can cause serious illness is COVID. And so any respiratory illness, consider ruling out COVID before coming down to a diagnosis of another respiratory illness or the common cold or the flu or so. The second point that I want to reiterate is the fact that, as Prof mentioned, other illnesses, other medical conditions, heart attacks, strokes, other pneumonias, all these different things continue. These are not things that have gone away because of COVID. So we must recognize that there are other deaths happening because of heart attacks and strokes and other medical conditions. What is very important here for our population to do is to control your NCDs, control your medical conditions, your diabetes, your high blood pressure, your cholesterol, all these things, so that you can maintain a healthy body and be able to deal with any other infectious disease such as the flu or COVID that may present to you. I must also say here that you will see advertising and upcoming towards the end of October, something called the Care Fairs. Our association has partnered with the RHAs to be a part of the Care Fairs, which is focused on NCDs and controlling and knowing your numbers to get under control your chronic health conditions. And the very last point is that we must also recognize that following our public health protocols, wearing the mask, sanitizing, keeping your social distancing, these are all protocols that are also going to benefit us in this flu season. So even if you do not have COVID and you pick up the regular flu, continuing to follow these protocols actually going to prevent you from spreading the regular flu to someone else. And that is something that we must also consider continuing even in this flu season in the context of COVID in the background.
And Professor Hariharan Sitharaman, I know you wanted to emphasize the statistics again and the importance of the vaccine. But before you do that, just very quickly, the flu season is with us, as would have been confirmed. This is a time when a lot of people will be traveling as well, to and from holiday period, Diwali coming up, there's Thanksgiving in the US, there's Christmas season coming up and so on. Are you concerned about a rise in infections of COVID-19 at this time when maybe more people that would usually be traveling will be traveling at this time, Professor?
Definitely, I am concerned with the with the people moving from place to place, and this season is we have seen that with the social mingling, with the celebrations, there is a definite rise in the population incidence of COVID. And all the more reason why we have to follow the public health regulations. And, yes, we cannot, be completely at home for 2 full years. I understand all those sentiments. And the one thing I want to implore everybody is that, I see many people, everybody become epidemiologists nowadays, and they say that, oh, it is not a disease at all. It's like any other disease. So you don't need to worry about it. It is not so. And one spurt during this season and, and a rise in case can lead on to a complete shutdown again, which we don't want. So I just want people to understand that, as much as we have controlled and we are all educated, I have told you in the initial phases of the pandemic that, Trinidad, follows public health regulations so well. And, I know that 1 or 2 people can be, an aberrant phenomena, but the majority of us are well educated and we follow the public health regulations. I want people to continue that type of public health and social isolation as much as possible during one season now, and then, this particular winter season. And then I am hoping that, over the next May, June, I think we will be seeing an end to this pandemic, and especially if the vaccines reach all the developing nations and everybody takes the vaccine. And in that note, I wanted to say again that we are not here as scientists to just advertise for vaccine, and we don't have any ulterior motives to promote this religion or preach this religion of vaccination. I must say that I on a daily basis I do go through studies which come up, and I can tell you that the religion of vaccination has helped in COVID so far, and if you want to consider it that way, I don't mind preaching it, but I'm just saying that there is enough evidence that vaccines save lives. And where we need to reach is the herd immunity. Like, that I am from India. I have seen diphtheria, whooping cough, and, you won't know, rabies, and, all sorts of diseases which I have lost patients. And we can't say one case here, because why? Only reason is vaccines. I haven't seen a case of measles here. Since I came, I haven't seen a case of whooping cough here, because people are vaccinated. I have encountered patients. I have lost children with whooping cough and diphtheria. That is the diphtheria is a very, very serious disease. So I don't know why people suddenly lost trust in science, suddenly lost trust in medicine. I understand that the major doubt is because of the fast nature of these release of the vaccines, but there is very, very good explanation for that, because we pumped in a lot of money to bring an end to the pandemic, and that is the only reason these vaccines came up. And we have the technology is much advanced, and we in our UV can actually make a vaccine if we have the money to do it. We have the technology here in UV. So that's why I wanted to say that do not trust all the other opinion pieces. Just trust science. Thank you.
Professor, I wish you all the best with that, because in the days of whooping cough and diphtheria, they didn't have social media, which is the challenge that everybody has to deal with as far as promoting foolishness. But certainly there are many different challenges in that regard. Well, Professor Sitharaman and, of course, Dr. Bihari as well, thanks very much for taking the time to be with us this morning. It's 7 o'clock in Trinidad and Tobago. Now time for the news headlines.